Good afternoon, YME community. Superintendent Mr. Schneider, joined by Crystal Enninga, again for your weekly update. I'm going to share my screen here, and then we'll go through the numbers here quickly before we talk about our decision that we made last night. So again, want to emphasize those are our 5 priorities, and they are in that order specifically. So prioritize the safety of students and staff as the #1 priority. So here's the numbers. As you can see, Chippewa County has grown significantly. Yellow Medicine County did drop down a little bit. We'll talk about it as that's progressing. We did see a little bit of a peak again today for the top 3 counties there. Renville is holding pretty steady. Redwood, pretty steady. Candy Ojai is seeing a significant growth. I suspect that as we go forward, Chippewa County will grow or stay at that level for a little while here. This puts us squarely in the middle of this recommended policy option from the Department of Education between 30 and 50. Elementary should be hybrid and the middle school, high school should be distance based upon that 14-day number. If we look at, you can see this is the number of counties, and it says schools again. I keep forgetting to change that, but it should be number of counties in each range. You see that we're shifting to the right. There's starting to get to be more and more schools over there with problems. And if you're listening to the news, you know that at least in the Twin Cities, the hospitals are starting to fill up. So we know that that's a little bit of trend there. Daily, this is from yesterday. The numbers were quite a bit higher today, but new cases as of yesterday, Yellow Medicine 4 yesterday, Chippewa 4, and Renville 10. I want to say that Yellow Medicine was 8 today, and Chippewa was 16, and Renville was 16. But total cases, so over the past week since we last met, going from the previous Thursday to yesterday, Yellow Medicine grew by 27 and increased by 1 death. Chippewa grew by 58 and there was no change in the number of deaths. And Renville grew by 35 and there was an increase in 2 deaths in Renville County. Countryside Public Health data, again, this is yesterday's totals. Case totals in Yellow Medicine County went up to a total of 306. That increased by 35 over the previous week. Active cases in Yellow Medicine County last week was 22. This week, 41. Percentage of positive COVID cases by source of exposure. We're starting to see that unknown grow a little bit, so a little bit concerning there. So we just need to keep an eye on that. Gives you an idea of where it's spreading. Countryside Public Health active case data, as I said, 41 in Yellow Medicine County. That grew by 19. Chippewa went to 110 compared to the previous week. So that grew by 6. Lackaparra County, and these are the only 3 counties that we have many students in. Those are those impacted. So Lackaparra County has dropped. Staff and student data. So as of yesterday, total staff COVID-related absences for the school year grew to 59. That grew last week by 12 staff members. Total staff positive school district-wide grew by 2 to 8. So that was as of yesterday, and we have seen, so this is Friday, we have seen some changes in these numbers already today. Total staff COVID-related absences as of yesterday. So students at BRE grew by 53. The middle school, high school grew by 16. Please keep in mind though, middle school or the high school, middle school comes every day, but the high school comes every other day. So that should really, that's the point of hybrid, that should slow down the spread a little bit. So it should have some positive effect. Total student positive district-wide grew to 11, so we grew by 3 in the past week. And again, that was impacted again after these numbers were put together. So It grew last week to yesterday by 3, and it grew again today. Current active data, BRE staff absent due to COVID. This is actively. We have 10 BRE staff that are out due to or related to COVID, middle school, high school staff. Absent due to COVID as of yesterday. This is yesterday's number was 6. District staff absent due to COVID is 6, and staff related to activities that are impacted by whether they're infected or affected is 2. During the 2021 school year, I want you to realize that this is impacting staff members. 45 out of our 138 total staff we have there, or roughly 32.6%, have been out multiple days. So just one day, because it was a cold, we're not pulling that in here. They've been out multiple days for COVID-related absences. 6 staff members have been out multiple times. So, and that's to be expected. Our model to be here causes us to quarantine a little bit more. So how's that impacting the students? Again, this was yesterday. Yesterday, when I checked this as of about noon yesterday, there were 15 middle school, high school students that were impacted. Our total enrollment at the middle school, high school combined is 382. So that's roughly 3.9%. But of those 382, 62 are in distance learning. So those coming into our building, when I say distance learning, they don't come at all. They have elected for distance learning. So our total enrollment in our middle school, high school is 320. So roughly 4.7% were affected yesterday. BRE right now, as of yesterday at noon, it was 51. That has grown again today, as should be expected. Our total enrollment in BRE is 295, 17.3% of that. But 26 of those kiddos are in elected distance learning. So our enrollment there is 269 actual. So roughly 19% of our elementary is impacted by COVID-related absences yesterday, actively impacted. So two classrooms are currently quarantined, and we'll talk about that a little bit later. I think everybody wonders why a classroom is sometimes quarantined and sometimes it's not. So here's the attendance that we have seen. I changed this up a little bit, so you can see we're above 90%. So that's good. So we've got that feather in our cap. And if a student is on distance learning, and even if it's COVID related, if they're on distance learning, they can be counted present. So that helps us out there. Here's the zip code data. In Granite Falls, in the past week, we've grown by 8. Canby has grown by 22. Clarkfield by 2. Henley Falls by 2. Porter by 3, no change in Woodlake, and Montevideo, as we suspected, grew by 50. And it looks like if we just go by the numbers today, that's going to be their trend for a little while here. It's unfortunate, so that's why they're in the current model they're in also. Predicting the future trends. So the top one just kind of tells you what we expected to get today and what we actually got. And so we're getting really close with this. I do get help. This is not just me doing that. So you can see we're really close to what MDH is coming up with. Now, but as we're further away from those dates, we aren't as accurate. So 1 week ago, I talked about that next week would be, so this is 1 week old data, we would be in Yellow Medicine County would be at 23.16. As of yesterday, it would be 43.31. It has changed already today, so it's probably going to tick up a little bit there. We might crack back into the 50s. Chippewa County, last week we suspected they would be at 90.53. And then this week we suspect that next week they'll be at 114. We'll see. They did go up quite a bit, like I said today. Expected for 2 weeks, we suspect if we use just our real-time data, we would be at 41.29 and Chippewa would be at 86.82. Really just, unless things just, we start getting 0 positive cases, I really don't see us staying that low. I anticipate that will go up. So a little bit of background information. Quarantine works. So we have had a number of cases, and I don't know exactly how many off the top of my head, where we were in quarantine and people have turned up positive while they're in quarantine. Last week, I think I said that that's like winning the lottery. Really, it's not. That's how it's supposed to work. I talked to the Department of Health yesterday, as I do weekly, and our incident response team. That's a regional thing that includes Upper Sioux community, the Department of Health, a representative of the response team from Southwest West Central Cooperative. We meet and we discuss all this information. And when I said, wow, we kind of won the lottery, they corrected me and they said, that's how it's supposed to work. People should turn up positive while in quarantine. Substitute coverage gets more difficult by the day and week. So we'll talk about that, why we made our decision that we did. Activities during DL, a lot has been put out, and you've probably seen that in the media about, can we have activities in distance learning? Well, if the reason is related to the numbers within our schools or within the activities themselves, activities should stop. In other words, if we see an outbreak there, they should stop. Now, I have heard of neighboring schools, I haven't heard it here, of neighboring schools where they've had athletes that are staying home and not being tested so they don't sabotage the team. That scares me. That scares me dramatically, that we could get something going in our community and not even realize it. So hopefully that's not happening. Let's get tested. I know it's painful. I don't want to do it, but it's painful to get tested. But keeping kiddos out when they could be positive is what works. So they have encouraged us to use the scalpel method when we analyze data. Scalpel method would mean that I carve out what's most applicable in our situation. We do not ever rely upon one single number. And I know that myth is out there, but please, I want to dispel that. We spend a lot of time going through all of this information. If I could get staff coverage a lot better, that impacts my decision, although it's not the only thing that's going to impact it. If we were to go to distance learning, food service, right now we are not set up to deliver. We are using a closed system, meaning that the USDA only will reimburse us for students that are enrolled at Yellow Medicine East. So we are offering grab and go curbside from 7:30 to 8 a.m. because that will have the least impact on the education of the students. Not perfect. We'll continue to work on that. Right now, that's the best we can offer. And I know that's hard, but imagine trying to work through all of this at one time. We are able to use DL preparation days, and what those are is those are non-student contact days where we don't offer distance learning and we do not offer skincare or food service. Eventually we'll probably get there where we could do some of that, but right now we're not able to do that. But it's still counted as a contact day, so we don't have to add days in June. That's not fun. When the weather's beautiful, we want to be able to get out of school. Childcare during DL, it's available if you're signed up. Some information will go out. If you have questions about that, and I'll touch on this again later, please contact our community education or our activities office, and they will help you with that. It will be supervised by our paraprofessionals. First of all, I want to reiterate, we understand the impact all of our decisions have on our families. And I know it's very hard to come in and out, but I also don't want to spend too much time in distance learning if we can avoid it. So if we can short spurts in distance learning and then return to in-person, whether it's hybrid or actual full-on in-person, we want to do that. We're entering a tough time health-wise in the year where flu and colds and stuff are going to impact it. So quite honestly, it's going to be hard for us to ever go all the way back to in-person. When I say in-person, that means that we don't have to maintain our 6-foot spacing as we do. And some of those things, we can bring all of our high school students into our schools. I know that's hard, and I know the students want to be here and they want activities to continue. These are hard decisions. But our model reflects the desire to safely have our greatest educational impact on students. And we believe we can do that by keeping them at school as much as possible. We know when we pull them out of school, that impacts you folks as families. Many of you are both parents are working outside the home, and so you kind of count on school as your childcare or supervision for your kiddos. I apologize for that, but there comes a point when I can no longer do that. It's not conscionable for me to be able to provide that opportunity. Other districts do look different. If you look at Montevideo's, theirs is not as sweet as ours. Maybe Lakeview's is a little bit sweeter. McRae is very similar to ours. Canby, they've been in distance learning too. They've also been in hybrid where they're not bringing in students as often as we are. So it looks different for each school. And there's a number of factors that affect that, all the way from staffing to building constraints, etc. But we try and get them in as much as possible. I would rather have the students here than elsewhere. Case investigations. There's an assumption out there that we automatically quarantine a class. We do not do that. We have to thoroughly investigate. When we thoroughly investigate, though, we're not going to provide the details out to families because we do have things we have to preserve. HIPAA is part of that. We also know, and I've heard reports of people that have tested positive and their friends have found out, and they get badgered by their friends and their friends' families. We don't want that out there. So that's why we don't provide more details, and the Department of Health tells us not to provide more details, especially if it's in the numbers where they could actually identify who the student is. So please do your best to avoid calling us out on social media. I know it's hard, it's stressful for you folks. Please know that I'm in agreement with you that these are challenging times. I'm going to do the best I can. School rules related to COVID are different than businesses. So we are not what's considered to be critical infrastructure. So like healthcare, that quarantine time or the exclusion time is a little bit shorter. Schools are not in that group. So we're a little bit different. We have to live by these rules. You cannot test out of a quarantine here at our school. Regional support team is consulted for each incident. So we asked them, did we investigate this correctly before we send anybody home or anything like that? So that involves the Department of Health, the regional support team, Countryside Public Health, Upper Sioux Community, and then of course, myself and our school nurse are on that when we talk about all this. So we try and be as thorough as we can. We are hearing stories of students getting together for bonfires and maybe getting together to work on their school, etc. Please avoid that. I know students want to be together, but if we make some of these sacrifices now, maybe we won't have as many problems that we are having in terms of coming in and out of distance learning. So remember, when we looked at things last night, so last night we decided to go distance learning. No single number was used. Everybody wants to pare it down to a single number. It's not. We have to look at everything because there are so many factors affecting it. So we look at staff member cases. Can we get the building covered? Next week, we only have 4 days of school. So we looked at that. That's one thing that I thought maybe worked in our favor. We look at student cases. So the middle school, high school appears to be low. Well, I can tell you after today, it's not as low. It's impacting them. We looked at the number of infected versus affected people. And I have shared that with you on the slideshow. So with that in mind, we decided to go distance learning. Monday will be a DL prep day. So there'll be no classes, no sting care, none of that, no food service. We need that time to get ready, and I apologize for that. Tuesday through Thursday will be distance learning. Your principals will be putting out information about how that will look, but that will be the plan for Tuesday through Thursday. And then Friday, as was on our calendar, it will be a staff development day with no classes, no sting care, no food service. So sting care will start Tuesday. Activities will continue as was voted last night. Okay. Crystal, should we hop into some questions?
Sure thing. Okay. Let's see here. Do we want to start way at the top, Rich? Do you have that
Sure. You know, I just want to reiterate one of the points I take these notes throughout the week is I want to reiterate to you. And when I talk to our superintendents, we talk about how should we handle these numbers. Some superintendents will fudge. They have a greater tolerance for this. Their community has a greater tolerance. So that's not my nature. I don't fudge the numbers. I'm going to tell you how it is. So I'm not saying this other superintendents are wrong, but I can tell you that I'm not going to lie to you. I'm going to tell you what I'm actually seeing. So please understand that. A great example of where we handle things differently, like I said, healthcare workers, they're going to be what's considered critical infrastructure employees. So they have a little bit more flexibility because we got to have those hospitals and clinics staffed. They're more important than definitely than a superintendent, that's for sure. We understand it's balance for all of you folks, so we apologize for that. And we know that's impacting you. We're seeing some people being shamed or confronted about it. You know, when I was coaching, and my dad always said, that's probably where I got the phrase, my dad always says, watch your own bobber. And so I used that when I was coaching. Unfortunately, that's what I'm going to ask you to do. Please don't call people out because they are admitting that they're positive or that they're quarantined. We just have to bear with it. I want it to go away as fast as possible. We want to hang on as long as we can so we can get a vaccine here. A little bit on sting care, more details. Please, we cannot host just like school. We're not going to be staffed there because we have people that are going to be teaching during that time. They're going to be teaching in distance learning. We do not have the same staffing. And those paraprofessionals are not just extra employees sitting around. They are written into students' IEPs and CLPs to provide supports to our students. And so we do not have extra staffing for that. So when we're in sting care, our primary goal will be supervision. We'll do the best we can to get onto those Zooms, but we can't guarantee it. It's not school, it's supervision. That is a challenge for you, I understand that. To qualify, both parents must be Tier 1 employees. You must have your employment verification form submitted to us to send them. If it's not submitted, we can't let you in. We need to keep those numbers low. We're not trying to be jerks about it, but we have to be able to provide all of our services. And if you have questions, like I said, contact Tim or Alyssa at our community ed office. Okay. All right. Go ahead. Let's start on some questions.
Okay, so guys, just keep in mind, these are the questions that were submitted via the link on the school website between the last time we spoke with you and today. So I am going to go through them now. So Rich, the first question is, why are we still continuing with sports when we are switching to distance learning? Academics should be our first priority, not sports. Can you just touch base on that?
Yes, and so The problem was discussed in great detail, and Crystal can attest to this. It took a long time to decide that one. We know that our students need some sort of interaction with others. Right now, we are not seeing an outbreak in our activities per se. And I also want to clarify, really the reason we went to distance learning was because we could not get all of our staffing covered. We couldn't get classroom substitutes or paraprofessional substitutes, custodians, cooks. We are short and we're doing the best we can to patchwork it. So the numbers really were not as a result of students in the building, it was staffing. And I can't solve that problem. We're using every available person that we can think of at this point that's qualified. You have to be qualified too, especially as a teacher.
Right. So just piggybacking off of the sports question from before, why are we allowing students who are choosing to distance learn full-time still play in sports?
Okay, distance learning is considered just like homeschool. Students that are in homeschool can participate in activities. That's the rules of the Minnesota State High School League. I'm going to follow those rules per se.
Okay. Will classes be utilizing Zoom for elementary age students as parents in healthcare and others on the road for work? They're asking us to consider doing more paperwork like Epic or IXL.
Okay.
Of Zoom.
That is an option for you folks. If you cannot get the live Zooms and you would like paper, please talk to your teacher or the principal associated with that, and we will try and work through that the best we can. We want it to work for everyone. We know that Zoom is not perfect. We're not expecting kiddos, especially in elementary, to be on there for 6.5 hours. So.
Right. Okay, who is going to contact families since they signed up for childcare and they have qualified for both tier 1 workers?
I believe Alyssa or Tim are going to send something out. If they haven't already, they will get something out today. They're doing their best to get on top of it right away and get that out. So I
did hear from Alyssa here just a little bit ago. There was an email sent. I actually got that email myself. So there was an email sent, but she wanted me to reiterate that if you do not have your paperwork in and you were not accepted and completed all that paperwork that Rich had alluded to, spoke about a little earlier, then you would have to contact them and get that process finalized before, again, you can send your child to STIN care. Okay. Why are there staff shortages when the local grocery store cannot shut down?
Well, first of all, we truly do have staff shortages and can't just shuffle people around. And kudos to the grocery store for being able to stay open. I don't know how they operate it or how their employees are staying healthy, but they're doing a great job. So I want to commend them for it. Unfortunately, I have to work with what I have. If I don't have substitutes, that's the best I can do. I can't just pull them out of my hat.
Yeah, and I can attest to that. I see it every single day in the office here. We are piecing together literally fluid puzzles every single morning, trying to pick and choose where we can place people and where we can move students that are still safe and still in our guidelines for our space. And it's not easy and it's getting harder. You said earlier it was by the day and by the hour, but it's literally down to the minute. We have things changing every single minute here and test results coming back, and it's complete chaos some days. So just hang with us. Okay, next question. I understand BRE is very short-staffed this week due to a couple cases in the school, and a lot have gotten quarantined. Can BRE be distance learning without the high school and middle school going into distance learning?
Yes, that can happen. We can carve out, that's the scalpel approach. We can carve them out of there, and that would change that. That was actually talked about last night, and maybe one thought I had is, well, if we close one building, then I can maybe shuffle some substitutes over there and at least keep one building going. And that was kind of where we were at the beginning of the school year when we shut down here at the middle school and high school, because that did give us some flexibility in terms of staffing.
Yep. Okay, so the 14-day case rate for Yellow Medicine County was as low as 41. This is the lowest it has been since early September. Today, 5 cases were added. How much does this affect the decision, given we have been in school in hybrid learning and our peak was up in the 70s?
Okay, so yes, we do look at the 14-day case count, but like I said, it's not the only number we look at. One of my slides shows you the difference that's happening over the 2-week time span. We also need to be aware of what's active at this point. So Yellow Medicine County being at 41 active cases, we need to consider that. We also need to consider how many active cases we have in our building. And like I said, we're investigating some as we speak that came up positive today. So
yeah. Okay, so on a recent Zoom, you warned additional activities means a very high likelihood an increase in COVID cases at school. This has simply not happened, and the data statewide does not prove any increase in cases attributed to extracurricular activities. Can you address your previous statement and provide a correction, given we are doing well with our activities?
well, and I wouldn't say we're doing bad, okay? I'm just saying when I say activities, I mean people out and about. The more times that we congregate together, the more likely we are to transmit it. It's no different than flu. I know when my parents were still alive that they got to a certain point where they weren't going to go to events, especially during flu season, because they were afraid they would be exposed. That's what we're talking about here, folks, that same type of philosophy. But we're not talking about just flu season. We're in a long, drawn out process of pandemic season or COVID season, so to speak. So we do look at those. That's one number we look at. Unfortunately, we have had some impact on our activities. We're going to try and keep them going because we know that's important to many families. So.
Why? Oops, sorry. Hold on. Doorbell. Why is BRE going a half day on Fridays and the middle high school is not going Friday at all? There are less contact hours required for elementary than middle high school. This doesn't make sense. I guess that's
okay. So first of all, when we go distance learning, those hours count as contact hours. So actually what we're using is Fridays for the middle school, high school. All day is what I like to call it an intervention day. It's not 100% all day long live instruction for middle school, high school. We need time for our teachers to prepare for distance learning because they have to do both. And I look at if I were in the classroom and I had to teach the kiddos there live and some students on Zoom, not every one of those students is able to be there on Zoom at that time. We need time to prepare for that. That's a lot of work. If you look at, so back in my day when I taught biology, chemistry, physics for the majority of my career. I'd have 3-4 different preps. So I might have advanced biology for 1 period and biology for 2 and chemistry for 2 and physics for 1. So I have all those preps to do and I have to get those developed in a way that can be taught over distance learning. Well, that's happening with our elementary kiddos and those are really, really hard because the teachers there are teaching live. Many of them are trying to also teach live Zoom to their distance learning kiddos at the same time. That is a ton of work and it's wearing on our employees. They are spending countless extra hours and we're trying to give them extra hours. That Friday time is part of that. We need that to be able to get some of that work done in the paperwork. Trust me, our teachers are working harder than they ever have and they're not lazy people. So.
yeah. Will or does hourly staff, so teachers, janitors, paras, etc., get paid if forced into quarantine? Is there a limit to where you do not pay them for a subsequent quarantine period?
Yes, there's only so much we can do. It's called part of the Families First Coronavirus Relief Act. So that's a mouthful. There's only so many days you get, and to go through it, it's different for each employee, because if a person can teach remotely, can fully cover their job remotely, then they wouldn't tap into that. They would teach remotely. But if a person cannot, for example, if I'm a building and grounds person, all right, I cannot do building and grounds from my house when I'm sick. That's just not a possibility. So we have to consider all of that, but there is a limited number of days we can use, and each situation is different. So it's hard for me to give a blanket statement about that.
Yep. What influence does the task force have in making the final decision, or is the final decision the superintendent? We have seen other school boards overrule the superintendents in other districts. Does the school board vote on these decisions?
The school board at the beginning of the year, as I said in one of our earliest ones, passed a resolution to allow me to make the decision. All right, I use what's called an incident response team. And we have actually, I believe there's 24 official members from varying groups, including parents and students. So they're involved in this. I realize the students haven't always been able to be there, but we rely upon them to give me a recommendation. Could I deviate from that? Sure. I think last week I talked about a snow day due to staff shortages. That could happen, and I think you want me to have that ability, but I'm not running this as a dictatorship unless I have to. You know, of course, I got to keep people's safety in mind. I'm going to do the best I can. It's not my nature to rule the roost, even though I had 28 years in the military. That's just not how I operate. I believe other people have just as much knowledge as I do, if not more.
Okay, going back to a couple sports questions here. Can we get a commitment from administration and school board to keep sports, assuming they are proven to be healthy? Not quite sure.
Sports are healthy. They are a healthy thing for you to do to keep yourself healthy. As long as we do not have spreads in there and the numbers are not even in our school, because those same kiddos that are in those activities are also in our school, we will continue with that. I'm not going to give a blanket statement, because we all know that that won't work. Just like in the beginning when they told us, I was told by the Department of Health and the Department of Education, you go by those numbers, you stay by those numbers. And obviously we've learned that they want us to alter it and to adjust to our local data. Rightly so.
Right. Has the district had any cases involving transporting students to activities? Because I know that was a big concern.
No, we have not. And that, to me, that's telling me it's working. But if it happens, we're not just thinking about the students here. If that happens on the bus, based upon the Department of Health recommendations, and we call them, all right, you don't want me deviating from those recommendations very much, because that would set us up in some ways for liability. I'm going to follow those guidelines. So I am so short on bus drivers. Actually, Rory is so short on bus drivers that I'm afraid if something happens there, if you folks aren't concerned about what could happen to the students, at least be concerned about what could happen to the coaches or to the bus drivers. But I don't want it to impact anybody if we can avoid it. That's the advantage of that. Might not work, but we'll see.
Right. Will the YME Hoops Club and JO volleyball teams and other outside organizations be allowed to practice in our gyms this year?
Yeah, Tim has a plan for that. Understand, practice is totally different than other events. At this point, we're not going to allow other teams into our buildings. That's just not prudent, and I think that's what most school districts are doing.
Yeah. How will you go about distance learning for students that are on IEPs? Students that maybe have physical therapy, how will they actually be receiving it if it is written into their IEP?
Okay, remember the decision we made this week was based upon staffing shortages. All right. That allows us to make some exceptions. Now it's going to take us, this stuff doesn't just automatically happen overnight. IEPs, those parents should contact their IEP manager because they should have a contingency learning plan during this time. Being we are in distance learning as a result of staffing shortages, we actually can bring some students on a limited capacity into our building. Now, understand we need to be careful when we do that stuff, because when we bring them in and we work with them, we want to make sure it's the highest need and we can have the greatest impact. So we can make some exceptions. If your student is one of those students that should be considered, please contact the case manager and or the building principal, and they'll work through that with you. So.
Okay. As far as food service, if meals are going to be distributed again, what happens to the families if they are unable to pick them up?
Yeah, I don't have a solution for that right now. That's why I said we're going to slowly chip away at that. We do not have the resources to deliver them to every house. And I can tell you when we did try and deliver them to houses last spring and into the summer, we would oftentimes not have people there to pick them up. We don't have someone sitting there to call and remind everybody that you need these meals or you signed up for these meals. It's an expense to us unless those meals are given out. And just as a reminder, I have a couple things I want to review about the food service. Understand we're following USDA rules. We're not making anything up. So I know there's some concerns about, say, can a student just have milk? Unfortunately, that's not a reimbursable meal, and that's what we have to go by. So reimbursable breakfast, reimbursable lunch meal, that's what we're going to go by. So milk is not free unless you take it as part of that meal at this point. Another comment was made about filling out educational benefits or free and reduced lunch application. You don't have to do that. You're right. We're going to continue to feed kiddos no matter what if you don't fill that out. But it costs the school district if you do not. It doesn't cost our food service program. We receive so many dollars as a result of the number of students that are qualify for educational benefits. It's called compensatory dollars. We get it in terms of title. We get it in terms of grants. Our integration dollars, and that's what runs our budget. So we can offer programs, we can offer transportation, and we can offer staffing. So that's why we need you folks to fill those out. We're going to continue to feed your student. Don't worry. That's not what's at stake here. We just want that information so we can get all the dollars that we're owed. Okay?
Yep. And as just piggybacking off of that too, Rich, seconds, I know you talked about milk, but seconds are also something that you would have to pay for. That is not a reimbursable meal. So just keep that in mind too for the families. Okay, how will children learn all their subjects that they need to learn, including music and Phi-Ed and distance learning?
Well, it should either be via Zoom through distance learning or by paper, pencil, whatever you work out with the teacher and the principal, including maybe a case manager if that applies.
Right. If our children are required to wear masks and social distance, why is a district sending entire classrooms home due to close contacts?
Okay, so we look at each of those individuals and we analyze this with the Department of Health when that occurs. We look at each of those individuals, whether it be a student or a staff member. We can't guarantee at all times during the day that those students are at least 6 foot apart and they have their mask on throughout the day. They're eating in their classrooms. We can't have them eat outside now because the weather hasn't been cooperating very well and probably won't until April or May. So we can't do that. We can't get the spacing out there. They are doing pretty good with compliance with masks. As we get younger, compliance with masks, We have students in our kindergarten that still suck their thumb, that lick their pens and pencils. And that's all stuff that we have to consider when we think about quarantining those kiddos. It's not a punishment to do that. That's not our intent. Like I said, it's working. We've had several people turn up positive during quarantine, and then it did not result in further quarantining. We look at each individual staff member who they had contact with, students, and we do the best we can investigating them. If they're younger, they might not be able to provide us with that information. So we contact and we talk to all the staff members that have contact with that kiddos. What's the likelihood of compliance? What do you think? When they're in their classrooms during the day, they're in there with their teacher roughly 6.5 hours in a day. It's pretty easy to accumulate 15 minutes of close contact.
Right.
Unfortunately, not all students are in compliance. So we do the best we can.
Yeah. Do you have a plan for children that will be in daycare all day and unable to do their distant learning and Zooms? Sorry. At scheduled times when both parents at work or do work full-time outside of the house, it is difficult to do that once they get home. Thoughts?
Yes, it is. We understand that, and that is challenging. If that means that you would like a paper pencil copy, we'll do the best we can. Now understand, in SynCare, we're gonna do the best we can, but that our primary goal is supervision, because we're gonna have students from a lot of different classrooms, and we're trying to keep them separate so they don't mix, but we'll do the best we can. Unfortunately, we can't guarantee that they will do that. Those paras are not their teachers. We're going to work around the schedule as best we can. And we're going to try and do the best we can in SynCare to make it valuable, even if it's not just schooling, so they can get on the playground, so they can do some fun activities.
Okay. The last few weeks, our numbers have been above 50 and we stayed hybrid. I know you kind of touched on this. Why are we going distance learning? We've already discussed.
Yep,
So,
staff issues is
yep.
That the staff are doing anything wrong. I just can't get the classroom staffed.
Yep. Okay. Let's see. I think we've touched on all of these. They're all kind of duplicated.
Yes, I think you're right.
So,
And please, if you have questions for next week, please submit them again. This is great. I appreciate this, Crystal. I do want to end on this. Please stay positive. I know it's hard. We're getting bombarded. I know it's challenging for you folks. I wish I could, with a magic wand, solve all this, and I can't guarantee that it's a hoax, and some people believe it's a hoax. So I apologize. I can't act that way. That's not how I operate. I can tell you, this is what I've always told my own children, and when I coach, this is or taught, this is what I emphasize. If you're having a bad day, do something to pick someone else up. Maybe reach out, maybe send a thank you card to a teacher maybe, or your neighbor, or knock on your neighbor's door and see how they're doing, or rake their leaves, or something like that. Do something positive for someone else, and I think it can change your attitude.
Right. Please
know, I understand where you folks are all at. We'll re-examine things again next week, next Thursday. My apologies. So that we are not stuck in this for 2 weeks, absolutely. No school Monday, no school Friday. Have a good break, and we will talk to you folks again next week. Thank you.